Hello, welcome to Agni Nursing Academy. So in this session, we'll discuss some important MCQs related to our OPS and Gynae. Okay, we'll first move on to the first question, that is a pregnant woman comes for her first antenatal visit at the 10 weeks of gestation. Okay, so the nurse knows that the ideal time for the first antenatal visit is, so option A is before 8 weeks of gestation, and option B is within the first 12 weeks of gestation, and option C is after 20 weeks of gestation, and D is at the time of quickening. Okay. So before going to this question and options, we'll discuss some important concept related to this antenatal visit. So that is also according to India and the WHO. Okay, so both are different guidelines we have. You can see here antenatal visits related to, so ideally antenatal visits are till the 28 weeks, that is means 7 months, up to 7 months of the pregnancy. So one visit per month is compulsory. You can see here means 7 month means 7 visit is compulsory, and next 28 to 36 week, for example 2 month, 1 in a 2 week means here 4 visit. Okay, and after 36 week, if more than 9 month happens means, so one visit per week is compulsory. For example, here you can take 2 to 4 visit, that is based on the preterm labor or postterm labor, means according to the when labor happens, so it will vary. For example, you can see 7 plus 4 11, 11 to 13 it will happen antenatal visit. Okay, and according to the WHO, minimum 8 visits should be compulsory. Understood? So according to WHO, minimum 8 visits is compulsory. And now we'll discuss according to the government of India. So here it will change, that is minimum 4 visits is minimum, antenatal visits is compulsory. And so when, here you can see first antenatal visit should be within the 12 week of pregnancy, and so second visit between the 14 to 26 week of pregnancy. Yes, and third visit is between the 28 to 36 week, and fourth visit is between the 36 week to till term or till labor. Understood? So this is important. According to government of India, minimum 4 visits is must and should. Okay. So now we'll discuss the question here. A pregnant woman comes for her first antenatal visit at 10 week of gestation. So you can see here first antenatal visit is within the 12 week of pregnancy. Okay. So here within the first 12 week of pregnancy. Understood? Yes, option B is right answer for this question, that is within the first 12 week of gestation is correct answer here. So please remember the guidelines according to the WHO and according to the Indian rules of antenatal visits. Okay. So if you want write, or otherwise you can take the screenshot afterwards you note it your notebook. Okay. So next question we will move on here, that is during the third trimester how many extra calories per day are required. The question is related to the calories per day required, that is recommended daily allowances. Option A is 200 kilocalorie, option B is 340 kilocalorie, and option C is the 452 calorie, and option D is the 600 kilocalorie. For example, I will tell, in that also we'll categorize for the normal people and the office going people and the hard worker. So this is the normal 3 category of the recommended daily allowances in India. But plus pregnancy we need to add extra calories, this 1700 plus and 2100 plus and 2700 plus we need to add according to the this pregnant woman. Yes, you can see here that is also in according to the trimester we need to add. So okay, you can see here in the first trimester of pregnancy plus 85 kilocalorie per day need to increase. For example, you can see here if woman's normal recommended daily allowance is 700, so then we need to add the 85 kilocalorie. If the normal pregnant woman RDA, normal woman RDA is 2100, so for that we need to add the 85 kilocalorie in the first trimester. So here also same, understood? And in the second trimester, 280 to 300 kilocalorie per day need to increase, plus this one means 1700 plus, so here you can say 200 to 280 to 300, 2700 plus 280 to 300 you need to add. Okay, according to that one. So here also you can see in the third trimester 450 to 470 kilocalorie per day need to add. Okay, so this is the very important question, remember, very important. So this is the 10-star question, understood? Important guys, so please take a screenshot or make a small note in your notebook. So this is the extra kilocalories per day are required according to the trimester also and according to the, her work, sedentary work, mild work and hard work. So that is also important. So this according to the her work. In the previous year examination this question was asked. Understood? So next we will move on to the third question. That is, so you can see here what is the average total weight gain, understood? Total weight gain recommended during a normal pregnancy. Total weight gain recommended during a normal pregnancy. So this we will considered according to the BMI, that is body mass index. Understood? So according to the body mass index, so we will consider the how much weight need to gain in the pregnancy. So please comment a comment in our comment box, that is what is the normal BMI. So please comment in our comment box, we'll see. Yes, you can see here body mass index formula is, so weight in kg divided by height in meter square, understood? For example, we'll see here weight, so you can take for example 50 kg weight is there and 150 height is there, 150 centimeter. So this one first we need to calculate in the meter square, means 50 kg is okay, it is in the kg only. This 150 centimeter we need to convert in the meter, that is 1.5 square, understood? 50 you write here, for example means 1.5 into 1.5, 2.25 it will happen. Otherwise also we can write it as the 225 divided by 100, so you can write here. Yes, please make a calculate. 25 4 the 4 8 the 9 the 25 4 the, so 200 divided by 9, 9 1 the, sorry 9 2 the, 9 to the same, it will come, means 22.2 it will come. So this is the a 50 kg, sorry, I will write here, a 50 kg woman, her height is 150 centimeter and her BMI is 22.2. So this parameter we will give here. So you can see here, underweight, if the female's underweight is there less than 18.5 and the normal woman BMI is 18.5 to 24.5. So our this female will come under the normal BMI. Okay, overweight is there means 25 to 29.9 and obese means 30 to 34.9 and extremely obese more than 35 BMI is there means, so that female will comes in the extremely obese. According to that one we will consider the weight gain recommended during a normal pregnancy. So let's see here, if the normal woman is there means normal BMI that is 18.5 to 24.9 is there means, so recommended weight gain in the pregnancy is 11 to 12.5. If low BMI is there means less than 18.5 is there means, so then weight gain should be 12.5 to 18 kg. And for the high BMI that is 7 to 11.5 kg and obesity more than 30 is there means, so 5 to 9 kg is recommended. So another one point you consider here, less the BMI, if BMI is less there means, so you can see here BMI is less but kg is increased. Okay, you can see here it is increased. So our means weight in pregnancy is should increase means vice versa, it is both are vice versa. BMI is decreasing means weight should be need to increase. If BMI is increasing means weight should be need to decrease means less amount need to increase. Here also need to increase only but less amount. So you can see here, if the obesity patient having a BMI of more than 30, only 5 to 9 kg need to increase. So another point I need to tell here, that is, so before for the normal BMI patient it was 11 to 17 kg, but now it has been changed to 11 to 12.5 kg for the normal BMI people. Okay, so let's see the question here. What is the average total weight gain recommended during a normal pregnancy? Understood? So now only we can see here, if the normal BMI is there means 11 to 16 kg is the correct answer for this question. Okay, yes, we'll move on to the next question, that is the RDA of calcium during the pregnancy is. So again the question is related to RDA, that is recommended daily allowances of the calcium. Okay, so before going to this calcium RDA, so we'll discuss some more RDA is there. For example, so you can see here hybrid carbohydrate, protein, fat. So these all RDA we need to clear in this question. So you can see here, so the RDA iodine is 250 microgram per day, means it is not milligram, it is a microgram. That is iodine RDA is 250 microgram per day and carbohydrate is 175 gram per day. And next protein, if non-pregnant woman is there means, so 45 gram per day is the normal for the non-pregnant female. And plus if the pregnancy is there means, so that also will considered according to the trimester, in the first trimester, second, third. So you can see here in the first trimester no additional protein is needed because actual fetal development which automatically happens in the second trimester and the third trimester. So for that purpose, no need of protein here needed in the first first trimester. Okay, so that you need to note in your point. And in the trimester 2 plus 10 gram, for example, you can see here we are getting 55 plus 10 means totally 55 gram additional protein need to give in the pregnancy in the second trimester. And here 45 plus 20 means you are seeing, no? Okay, 65 gram of protein here need to give in the third trimester. Okay, so these all are the important questions for the all upcoming examination. Next you can see here, that is fat. Here fat also we need to consider, that is 28 gram per day is a recommended daily allowance in the pregnancy. Okay, so here the question is related to calcium, but when not written here, but either that is B. Option B is the right one for this question, that is RDA of calcium during pregnancy is 1000 mg per day. Understood? So here the option B is the correct answer. Understood? So along with this one, for our Agni Nursing Academy by the expert team, so we are giving the daily test series for the next, that is NORCET-10 examination. So that we will be as the same pattern, that is section A, B, C, D, E, and one section contains the 18 minutes time. Understood? Yes. Along with that one, now only CRE recruitment has been initiated. So for that also we are giving a test series. So that should be same as the CRE pattern only. So already date has been fixed. I think December 22 to between December 20 to December 24, in between our SNO and that staff nurse grade 1 and 2 examination is there by the common recruitment examination by AIIMS Delhi. So for that also we have initiated the test series by the expert team only. Understood? So please consider and just attend the test. Also we have providing the Saturday pre-test. So one separate folder is there. So first you visit that separate folder, you give a 1, 2, 3 test, you give attend. So if you are okay with that questions, then only you consider and please enroll for our daily NORCET Agni test series. Understood? Yes. We move on to the next question, that is the first dose of TD1, that is tetanus and diphtheria of the tetanus vaccine should be given at. So this vaccine in the pregnancy. Understood? Yes. Option A is the 8 weeks of gestation. Option B is as early as pregnancy is confirmed. And option C is after 28 week of pregnancy. And option D is the after 36 week of gestation or pregnancy. Yes. We'll discuss the concept related to this all vaccines, not only this TD vaccines. One second. All vaccines we will give in the pregnancy, means which all are the vaccines is contraindicated and which all are the vaccines we can consider and give in the cases of the contraindications also, and which all are the vaccines which are absolutely contraindicated in the pregnancy. So that we'll discuss here. Okay. So here you can see vaccination in pregnancy, and first vaccine, that is TD, that is tetanus and diphtheria. So that should be will give in the 2 doses. For example, if the pregnant is first pregnancy. Understood? So the female is having a first pregnancy means we need to give the 2 doses whenever, sir. So whenever as early as possible, we will know that pregnant, that lady has been pregnant. So that time as early as possible, we need to give the first TD vaccine. So you can see here, or first antenatal visit, or as soon as the pregnancy confirmed, whether it may be day or any other test. So sure. And after the gap of 4 weeks, so we need to do the second dose. Understood? So after 4 weeks gap of the first dose, as soon as the pregnancy is confirmed, or first antenatal visit, we do the first dose of the Sgpgi vaccine, and after the 4 week gap, means after 1 month, we need to give the second dose of the Pggi vaccine. And so I have told that is the first pregnancy is there means, sir, okay, if the second pregnancy means, so that gap between first and second pregnancy is if 3 year means no need to give the dose, booster dose. So see here, if past 3 year pregnancy history taken 2 doses means, so then sir we need to give only one booster dose. Understood? Means yeah, first pregnancy and second pregnancy is only 3 years or less than 3 years is there means, so just we need to give the booster dose. Sir, if more than 3 years happens means, so again we need to start from the first dose and second dose. Understood? Yes. So this is the important related to tetanus and diphtheria vaccine notes. Answer. So next we discuss related to PEDAP, that is tetanus plus diphtheria plus pertussis, that is AP means acellular pertussis. Understood? So you can see here tetanus, diphtheria plus pertussis, that is also acellular. Sir, here first dose between the 27 to 36 week of the pregnancy we need to give. Sir, first dose between 27 to 36 week of the pregnancy we need to give this vaccine. Only one dose is needed, it's sufficient. Okay, next. Sir, next vaccines we will see here, that is the third one, influenza. So whenever the pregnant lady crosses the month of October to May, so this is the highly risk of flu disease. Understood? So in the month of October and May, if lady is pregnant, so compulsory we need to give the one dose, only one dose of influenza vaccine, so that should be need to give in the IM. The route of influenza vaccine is IM, so this is a star mark question. Understood? And so this means all the vaccines are important for the upcoming future examination. Okay? Yes. Sir, another one important vaccination, so that is our COVID-19. Understood? So when this vaccine need to give, sir? At any trimester you can give this COVID-19 vaccine. So if female not received earlier means, understood? If female is not received earlierly, so any time, it may be trimester 1, 2, 3, so we can give this COVID-19 vaccination. And sir, if some contraindications are there to give this vaccination, so that and all we will discuss here. Vaccines given in some special circumstances. So first of all we'll tell, sir, live attenuated vaccines are contraindicated in the pregnancy. But so then also we'll give some vaccines, that is yellow fever, polio and typhoid. These vaccines we will give in the some circumstances. When, sir? So when this disease is endemic in the pregnant lady area. Understood? So in these circumstances we can give the yellow fever vaccination, polio vaccination and typhoid vaccination. Understood? So please note it down. And also if she is taking a flight or she is going to the other country also, so this vaccination certificate is compulsory. So that time also we will consider, and we will give in the, it will consider it as a special circumstances. So that time also we will give this yellow fever, polio and typhoid vaccination. Understood? So please consider, so whenever she is crossing or she is taking a flight and to the another country, and so whenever the endemic is present in her local area, that time we will give this vaccination. Understood? Important, sir. Yes. Vaccines, which are vaccines safe in the pregnancy, so that we will see here. That is, one second. Vaccines which are safe in the pregnancy, so we will see here, means all the dead vaccines are safe in the pregnancy. Understood? So that may be hepatitis A, hepatitis B, and pneumococcus, and the meningococcus, and the rabies. Understood? So these all 5 vaccines are easily we can give in the cases of the pregnancy. Okay. Yes, sir. Next you can see here. And sir, which vaccines are absolutely contraindicated? So I already told some vaccines are we will give in some case, means in the special circumstances, that is polio, typhoid, and the yellow fever. Understood? So here these are absolutely contraindicated. That one, that is MMR. So you can see here measles, mumps, and rubella. So these vaccines are absolutely contraindicated, and smallpox, and the chicken pox, and BCG, and HPV vaccine. So this is human papilloma virus vaccine. Human papilloma virus vaccine. So these all are contraindicated in the pregnancy. In any cases we can't provide this vaccination. Okay? Yes. We move on to the next question, that is related to sexual intercourse should be avoided in which of the following conditions. So about these questions also in the previous year, that is in the 2022, means 2022 NORCET-10 examination asked this question. This is important. This is PYQ. Okay, so option A is the nausea and vomiting, and option B is the fatigue, and option C is the placenta previa or vaginal bleeding, and option D is the constipation. Yes, please comment in our comment box. So this question you easily select it as option C, but behind this one we'll discuss some concept related to this one about sexual intercourses in the pregnancy. So you can I will tell, means sexual intercourse is not contraindicated in the pregnancy as a normally. Understood? If the female is normal, so means any, she don't have any abnormalities like a placenta previa or some diseases are there, so we'll discuss that one. If that diseases are not there, means not contraindicated up to the 36 week of pregnancy. Understood? So whenever contraindicated means, so we'll see, contraindication of intercourse in pregnancy, that is first one, if she is having the threatened abortion. So this abortion, so various types are there: inevitable abortion, missed abortion, so threatened abortion. So these are all the classification of the abortion. So this concept we will discuss in the next session. Okay. And placenta previa, and in the premature rupture of the membrane, and in the preterm labor. Okay, sir. So these all are the contraindications of the intercourse in pregnancy. These are the absolute contraindication. So if we leave this one, means so there is a no contraindication of sexual intercourse in pregnancy. Okay. So in the placenta previa, normally, so you can see here, this is the uterus. Normally the attachment of the this placenta will be happen in the upper uterine segment, and so this is the lower uterine segment. So here the placenta will attach, that is also posterior side and upper posterior side of the uterus. But if this placenta is attached in the lower segment means, so this we will call it as the placenta previa. Okay, so that time, so this is intercourse is contraindicated. Okay, understood? Yes sir. We move on to the next question. So for this one, our answer should be placenta previa or the vaginal bleeding. Yes, sir. So we'll move on to the next question. That is, the nurse instruct a pregnant woman that moderate exercise during the pregnancy helps to. The question is related to exercise during the pregnancy. Option A is reduce blood volume, and option B is the improve muscle tone and circulation, and option C is the delay uterine growth, and option D is the decrease placental blood flow. So first of all, please comment in our comment box, that is exercise is good or bad, and how much time need to do a exercise per week or per day. So please, for these all questions, please comment in our comment box. Understood? And if over exercise is there means what happens? Understood? For these questions, please comment. We'll wait for the 10 second. That is, this question is related to the exercise during the pregnancy. Okay. Option A, B, C, D. Option C, option C, option B. Yes. So we all know that the answer for this question is it improves the muscle tone and circulation is the correct answer for this question. But still more important points we need to cover here related to exercise. So you can see here, sir, actually 30 minutes per day or 150 hours per week is a considerable exercise. So mark here or write here, 30 minutes per day or 5 days per week exercise is compulsory in the pregnant woman. For example, 30 minutes per day means for the 5 days total 150 hours per week. At least this much exercise is compulsory in the cases of the pregnancy. Okay. Yes. So whenever the contraindication is there for to do a exercise in the pregnant woman means, so heart disease is absolutely contraindicated. And sir, in the cases of the pulmonary disease, it may be lungs, it may be bronchi, bronchiolitis, so these all are the conditions is contraindicated for the exercise. And risk of the preterm labor and bleeding is there means, so it will increase the exercise, increase the tonicity of the uterine muscles, so again it will cause to further bleeding in that case. And pregnancy induced hypertension, and in the cases of the placenta previa. So these all are the conditions for especially bleeding, this PIH, that is pregnancy induced hypertension. So it will lead to further severe bleeding. So it will lead to the bleeding risk is there. So for that purpose, and in the cases of heart disease and pulmonary disease, so there is a risk of the shortness of breathing is there. So for that one, so exercise is absolutely contraindicated in this special condition, that is heart disease, pulmonary disease, risk of the preterm labor, bleeding, PIH, and in the placenta previa. Okay. This much we have covered the almost very important MCQs. So again we will come with the another beautiful session with the beautiful important MCQs, so that are previously, so these all are the questions and concept based on this concept previously question has been arrived. in the NEET PG. Understood? So that questions only I am taking in this class. So please connect with our Agni Nursing Academy. So what all are the means we will update daily recruitment basis, means any important notice we will circulate in our WhatsApp group, and daily at the 6 p.m. Understood? Daily, without not a single day missing. Daily we conduct a 50 MCQs pre-MCQ session in the Telegram at exact 6 p.m. and along with that one daily test we will conduct in our Agni Nursing Academy. So please download our Agni Nursing Academy. So that link will provide in the description box. Okay, and Saturday, every Saturday pre-test will be there in that our Agni app only. Understood? So these all are the facility we will give, and in that YouTube also daily session we will conduct. Understood? So please, if you like the video, so please like and subscribe to our channel. If you like the video, if you have got any one to two concept extra in this session, so please share to your friend also. Understood? Okay, thank you, bye bye. We'll come in the next session. Thank you everyone.